In Good Shape, your weekly dose of health information on Deutsche Welle. Find out more about what's new in medical treatment, alternative medicine, as well as nutrition, wellness, and beauty. Medical professionals, therapists, and counselors are in our studio to offer their expert advice on In Good Shape.
Joining us now in the studio is Dr. Christian Straßburger, a thyroid specialist from Berlin's Charité Hospital. Hello, welcome in the studio.
Thank you.
Hi. An underactive thyroid gland doesn't produce enough hormones. How does this come about?
The most common cause for patients suffering from their thyroid gland not sufficiently producing thyroid hormone is an autoimmune disease, which means that our body's defense system, which should usually only attack foreign things like bacteria or viruses, makes a mistake and attacks its own tissue, in this case, the thyroid gland. You can compare this to the old Pac-Man computer game where you have this circle with a mouth which is chewing up little bits and one after the other. So when the immune system does this with the thyroid gland, it leads ultimately to very small remnants which no longer can provide enough hormone for the body.
And the typical symptoms of an underactive thyroid gland is weight gain. What else symptoms are there?
Weight gain is only a symptom when lack of sufficient amounts of thyroid hormone has persisted for quite a long time. Since thyroid hormone is like the spark in a car's engine for our metabolism, it will determine how much of metabolism is going on, and therefore patients with insufficient amounts of thyroid hormone will feel more easily cold. They will prefer to turn up the heating in a room where their colleagues, for example, would prefer to open the window. At the same time, bowel movements become less frequent and the whole metabolism is driving down. So in the long run, this will also lead to weight gain, but it's not typically the first sign.
Okay. And how is a hypofunctional thyroid gland usually treated?
The treatment is to replace what's missing. So we give these patients thyroid hormone. Lucky enough, we have thyroxine, which is absolutely identical to what the body makes itself. So there is no fear that there would be any side effects if it is appropriately dosed.
And on the flip side, there's an overly active thyroid gland. And what are the symptoms for those patients?
It's actually also the flip side of hypothyroid symptoms. So these patients are more nervous. They are easily sweating, even at states where they have only minor exercise, for example, or stress. They have more frequent bowel movements and they are easily sweating. They prefer cold environments, actually. They are the ones who open the window when their colleagues are saying, hey, I'm chilly anyway, so why do you open the window?
So it's quite the contrary then. And what factors lead to those overly active thyroid glands? It's usually not Pac-Man, is it?
There are two major causes. One of them is thyroid nodules, which initially have formed because there may have been iodine deficiency, which leads to the formation of thyroid nodules. Such thyroid nodules may be autonomous, which means they don't care how much thyroid hormone the body needs, and they are behaving in a strange way that whenever they get hold of iodine, they turn it into ready-produced thyroid hormone, regardless of how much the body would need. So these are called autonomous or toxic nodules. On scintigrams, they show up in colors which we associate typically with high temperatures, so we call them hot nodules. The other cause, again, is an autoimmune disease, but in this case, antibodies are not destroying the thyroid, but these antibodies are speeding up the hormone production by stepping on the accelerator of the thyroid gland.
Dr. Straßburger, how common is thyroid cancer?
Thyroid cancer affects about 400 out of 1 million people per year, which, if you recalculate it, is 1 in 2,500 people are affected. But when you want to put this into perspective with other cancers, colon cancer, for example, is 8 times as frequent. The interesting part about thyroid cancer is females are 3 times more frequently affected than males, and I cannot tell you why.
Okay. And what is the recovery rate?
The recovery rate is extraordinarily high. In cancer medicine, we always look at the 5 years survival, which means after the diagnosis is made in a given patient, which percentage of these patients patients are still alive 5 years later. And this figure is extraordinarily high in thyroid cancer, with 99.9% of all affected patients still being alive. The reason being that there is not only surgeons who will remove the thyroid cancer and possibly affected lymph nodes as well, but the characteristic of thyroid tissue, that it is always trying to take up iodine, is used to destroy or burn, if you wish, possible small remnants of thyroid cancer with radioactive iodine. So you can really get rid of all the cancer cells and therefore give the patients a very good chance of survival.
The cause of the good prognosis. Patients with an enlarged thyroid glands often are very afraid that they have cancer. Is there any link between goiters and cancers?
Theoretically, a nodule or an enlargement in the thyroid can be cancer. However, for example, in Germany, which is an iodine deficiency area, the likelihood of a nodule in the thyroid really being malignant is only 1%. In the United States, where there is sufficient iodine supply by adding iodine to the flour, which is used for baking bread, 1 out of 4 nodules is malignant, which only means that they have less tissue nodules which are benign and the result of iodine deficiency. The cancer rate per million inhabitants is the same.
Okay. And talking about those enlarged thyroid glands, the goiters, how do goiters develop?
They typically develop as a consequence of iodine deficiency. Okay. And it's a complex biochemical pathway by which iodine is actually built into so-called iodolactones, which then inhibit growth factors. And it's a complex mechanism by which several factors then contribute to the enlargement of the thyroid gland, which we then call a goiter. What people have to note is there is no strict correlation between size and function. So big thyroid glands can be making too much hormone, but they can also be making not enough hormone.
Okay, and if it's all about iodine, can you cure goiters with a good nutrition?
Actually, you can try to prevent thyroid diseases by making sure that you have sufficient iodine supplies in your nutrition. And this you get by trying to consume deep-sea fish.
Okay.
So, for example, when you are consuming Bavarian trouts, you won't help the situation at all because these trouts even have a little goiter themselves due to lack of iodine. But deep-sea fish is helpful. Seaweed is very rich in iodine, and iodine-rich nutrition can prevent thyroid problems.
Okay. Professor Straßburger, thanks so much for being with us in the studio today. Thank you.